Hey there, my sleepy friends. Tonight, we're going to talk about your face. Not in the way a mirror does, with all its judgments and morning surprises, but in the way a naturalist might observe a landscape. With patience, with curiosity, and with the understanding that even the most familiar terrain holds secrets worth discovering. So settle in, dim those lights if you can, and let's drift into the fascinating realm of something boring about human anatomy. Now your face is 22 bones working in concert. 22 separate pieces that began their lives as islands in the soft cartilage of your developing skull, gradually ossifying, hardening, and finding each other across the geography of your head like continental plates drifting toward inevitable union. Some of these bones you've heard of. Others have names that sound like forgotten Roman generals or obscure musical instruments. Let's start with something simple. Touch your forehead. Go ahead. There's no one watching, and even if there were, they wouldn't think it strange. You're touching the frontal bone, a single curved plate that forms not just your forehead, but also the upper portions of your eye sockets. It's shaped rather like a shallow bowl turned upside down, and in a child it begins as two separate bones with a suture running right down the middle. By the time you're 6 or 7 years old, that suture has usually fused, leaving you with one continuous piece of bone where there used to be two. The frontal bone does more than give you a place to furrow when you're thinking. Behind it, just above your eyes, lie the frontal sinuses, hollow spaces in the bone that make your skull lighter than it would otherwise be. Evolution is economical that way. Why carry around solid bone when air will do? These sinuses also give your voice a bit of resonance, a fact you notice when you're congested and suddenly sound like you're speaking through a pillow. Now move your fingers to your temples. Feel that slight depression on either side of your head? You're touching the temporal bone, though you're actually feeling where it meets several other bones. The temporal bone is one of the more complex structures in your skull, and it does far more than you might expect. It houses your inner ear, with all its delicate machinery for hearing and balance. It provides attachment points for muscles that help you chew. It articulates with your jawbone, making it possible for you to open and close your mouth. The name temporal comes from the Latin word for time, because this is where your hair first starts to grey. At the temples, where time leaves its most visible signature. The Romans noticed this, and the name stuck. Your temporal bone has several distinct parts, each with its own character. There's the squamous part, thin and flat, forming that depression at your temple. There's the petrous part, which is anything but flat. It's one of the densest bones in your entire body, a rocky pyramid buried deep in the base of your skull, protecting your inner ear like a vault. And then there's the mastoid process, that bony knob you can feel just behind your ear. It's filled with small air cells, like a honeycomb, and when these become infected, a condition called mastoiditis, it can be quite serious. Let's drift downward now, to your cheekbones. The medical term is the zygomatic bone, though cheekbone is perfectly adequate and considerably easier to remember. These are the bones that give your face its width, its character. High cheekbones, prominent cheekbones. We talk about them as though they're aesthetic choices, but really they're structural elements, like the flying buttresses of a cathedral, distributing the forces of chewing across your face. The zygomatic bone connects to 4 other bones: the frontal bone above, the temporal bone to the side, the maxilla below, and the sphenoid bone deeper in. It's a social bone, if you will, constantly in conversation with its neighbours. When you smile, a genuine smile, not the polite kind you give strangers in elevators, your zygomatic major muscle pulls on this bone, lifting your cheek and narrowing your eyes. That's why genuine smiles create crow's feet at the corners of your eyes. The bone and muscle are working together, and the skin just comes along for the ride. Speaking of smiles, Let's talk about your upper jaw. The maxilla is a paired bone. You have a left maxilla and a right maxilla, which fuse together at the midline during development. This bone is doing several jobs at once. It forms the floor of your orbit, which is the formal name for your eye socket. It forms the roof of your mouth. It holds your upper teeth. It contains the maxillary sinus, another one of those air-filled spaces that keeps your skull from being unnecessarily heavy. The maxilla also forms most of your upper lip's bony foundation and the sides of your nose. If you've ever seen a skull, you've noticed that where a living person has a nose, the skull has a rather alarming triangular opening. That's the piriform aperture, and it's bordered primarily by the maxilla. Your actual nose, the part that sticks out, the part that runs when you have a cold, is made of cartilage, not bone. The bones just provide the foundation and the entrance. Here's something interesting about the maxilla. When archaeologists find ancient human remains, one of the things they examine closely is the maxilla, because the way the upper jaw is structured can tell them about diet, health, and even social status. Where patterns on teeth, signs of infection, evidence of malnutrition, it's all written there in bone. Now let's move to one of the stranger bones in your face, the sphenoid. If the skull were a butterfly, the sphenoid would be the body of it, with wings spreading out to either side. It sits deep in the center of your skull, behind your eyes, wedged between multiple other bones. Sphenoid comes from the Greek word for wedge, which is exactly what it looks like. The sphenoid is sometimes called the keystone of the cranial floor because it touches almost every other bone in the skull. It articulates with 12 other bones, making it one of the most connected structures in your skeleton. At its center is a small depression called the sella turcica, which translates to Turkish saddle. Sitting in this bony saddle is your pituitary gland, a pea-sized structure that controls growth, metabolism, reproduction, and stress responses. So this wedge-shaped bone, hidden where you'll never see it, cradles one of the most important glands in your body. The sphenoid has two wing-like projections on each side, the greater wings and the lesser wings. The greater wings form part of the side of your skull and part of your eye socket. The lesser wings are smaller, forming the back of the roof of your eye socket. Between these wings are openings, foramina in medical terminology, through which nerves and blood vessels pass. The optic nerve, which carries visual information from your eye to your brain, passes through the optic canal in the sphenoid bone. Without this carefully positioned opening, you wouldn't be able to see. Let's talk about your eye sockets for a moment, since we've mentioned them several times. The orbit is a remarkable piece of engineering. It's formed by contributions from 7 different bones: the frontal, sphenoid, zygomatic, maxillar, lacrimal, ethmoid, and palatine bones. 7 separate bones, all meeting at precise angles to create a protective cavity for one of your most delicate and valuable organs. The orbit is shaped like a pyramid, with the apex pointing back toward your brain and the base opening forward. This shape provides maximum protection while allowing for a wide field of vision. The walls are thick enough to protect, but thin enough that they can fracture to absorb impact, potentially saving your eye in a traumatic injury. It's a design that suggests both strength and calculated sacrifice. At the inner corner of your eye, you can feel a small bump if you touch gently. That's the lacrimal bone, the smallest bone in your face. It's about the size of a fingernail, and its primary job is to house part of the lacrimal apparatus, the system that produces and drains your tears. The lacrimal gland sits just under your eyebrow, constantly producing a thin film of tears that keeps your eye moist. When you blink, you spread this film across your eye. Then the tears drain through 2 small openings in your eyelids, flow through narrow channels in the lacrimal bone, and eventually empty into your nasal cavity. That's why your nose runs when you cry. You're not producing nasal mucus. You're just draining excess tears. Behind the lacrimal bone and deeper still is the ethmoid bone, one of the most intricate structures in your skull. Ethmoid means sieve-like, and the name is apt. This bone is filled with air cells, small, hollow spaces that reduce weight and provide surface area for the mucous membranes in your nose. The ethmoid also contains the cribriform plate, a thin sheet of bone perforated with tiny holes. Through these holes pass the threads of your olfactory nerve, carrying information about smell from your nose to your brain. The cribriform plate is one of the most delicate bones in your body. It's so thin that it can fracture from a blow to the face, and when it does, cerebrospinal fluid, the clear liquid that bathes your brain and spinal cord, can leak into your nasal cavity. This is why doctors often warn against blowing your nose forcefully after a head injury. That clear fluid dripping from your nose might not be what you think it is. Let's return to the surface now, to your nose. The visible external part of your nose is supported by cartilage, but the bridge is formed by the nasal bones, two small rectangular bones that extend down from the frontal bone. These are the bones that break when someone is punched in the face, the bones that get reshaped in rhinoplasty, and the bones that give your nose its basic shape and profile. Below the nasal bones, the septum divides your nasal cavity into right and left sides. The back of the septum is made of bone, contributions from the ethmoid and a separate bone called the vomer, but the front is cartilage. This forward portion is what gets deviated in a deviated septum, causing one nostril to be more open than the other. Inside your nasal cavity, projecting from the lateral walls, are structures called turbinates or nasal conchae. They look like scrolls or seashells, creating a maze that incoming air must navigate. This maze serves several purposes. It warms the air, humidifies it, and filters it. By the time air reaches your lungs, it's been conditioned to match your body temperature and humidity, thanks to this bony labyrinth. Now let's drop down to your jaw. The mandible is the only bone in your skull that actually moves. Every other bone is locked in place, joined to its neighbours by immovable joints called sutures. But the mandible hinges at the temporomandibular joint, allowing you to open and close your mouth, to chew, to speak, and to yawn at boring lectures. The mandible is the strongest bone in your face, which makes sense given what it has to do. When you bite down, you can generate tremendous force, upward of 150 pounds per square inch. That force is transmitted through your teeth into the mandible, which must be strong enough to handle it without fracturing. The mandible is horseshoe-shaped, with a horizontal body that forms your chin and two vertical rami that extend upward toward your ears. At the top of each ramus are two projections, the coronoid process and the condylar process. The coronoid process is where your temporalis muscle attaches, one of the muscles that closes your jaw. The condylar process ends in a rounded knob that articulates with your temporal bone, forming the temporomandibular joint. This joint is unusual. It's not a simple hinge. It's a modified hinge that can also slide forward and backward, side to side. This versatility allows you not just to open and close your mouth, but to grind your teeth together and to move your jaw from side to side when you chew. It's a sophisticated joint, and unfortunately, it's also a joint that frequently develops problems. Temporomandibular joint disorder, TMJ disorder, affects millions of people, causing pain, clicking, and limited movement. At the front of your mandible, at the midline, is your chin. This is a uniquely human feature. No other primate has a protruding bony chin. Chimpanzees, gorillas, and even our extinct relatives like Neanderthals None of them had chins. The human chin is a recent evolutionary development, appearing only in the last few 100,000 years. Why do we have chins? Nobody knows for sure. There are theories that it provides structural reinforcement where the two halves of the mandible fuse, that it's a sexual ornament like a peacock's tail, and that it's simply a byproduct of our faces becoming smaller and flatter as we evolved. But the honest answer is that we don't know. We just know that we're the only species that has them, and we've had them for a relatively short time in evolutionary terms. Let's talk about your teeth for a moment, since they're anchored in your mandible and maxilla. You have 32 teeth if you're a fully dentate adult with wisdom teeth, or 28 if you're among the many people who've had those third molars removed. Each tooth sits in a socket called an alveolus, held in place by the periodontal ligament, a fibrous tissue that acts like a shock absorber, allowing your tooth to move ever so slightly when you bite down. Your teeth are not technically bone, though they're harder than bone. They're made primarily of dentin, covered on the crown with enamel, the hardest substance in your body, and covered on the roots with cementum. Enamel is so hard that it can't repair itself. Once it's damaged permanently. Dentin, by contrast, can regenerate to some degree if the damage isn't too severe. The arrangement of your teeth tells a story about your diet and evolution. Your front teeth, the incisors, are shaped like chisels, designed for cutting. Your canines are pointed, though far less pointed than a dog's or a cat's, and designed for tearing. Your premolars and molars are flat, designed for grinding. This combination of tooth shapes indicates an omnivorous diet. You're built to eat both plants and meat, to process a wide variety of foods. Compare your teeth to those of a carnivore, and the differences are striking. A cat has prominent canines and sharp, jagged molars called carnassials that work like scissors to shear meat. Compare your teeth to those of an herbivore like a cow, and again the differences are clear. A cow has large, flat molars for grinding plant material, but no prominent canines at all. You're somewhere in between, adaptable, capable of eating whatever is available. Let's return to the bones now, specifically to the small bone at the back of your nasal cavity called the vomer. This is a thin, flat bone shaped like a ploughshare. In fact, vomer is Latin for plough. It forms the bottom and back part of your nasal septum, that wall dividing your nose into left and right halves. The vomer is a modest bone, rarely getting much attention, but without it, your nasal cavity wouldn't be properly divided. There are two more bones we should mention, though they're so small and so hidden that most people never think about them. These are the palatine bones, L-shaped structures that form the back part of the hard palate, the roof of your mouth, and parts of the nasal cavity and eye socket. They're tucked away where you can't see or feel them, but they're there, doing their quiet work of providing structure and support. The hard palate itself is worth discussing. It's formed by the palatine processes of the maxilla at the front and the horizontal plates of the palatine bones at the back. This bony shelf separates your mouth from your nasal cavity, allowing you to breathe through your nose while you eat. Some animals don't have a complete hard palate, which means they can't breathe and eat at the same time. You can, thanks to this bony division. At the back of your hard palate, tissue takes over. The soft palate is exactly what it sounds like, soft tissue rather than bone. It's mobile, lifting when you swallow to close off your nasal cavity, preventing food from going up into your nose. When you snore, the soft palate is often the culprit, vibrating as air passes over it during sleep. Now let's step back and consider the skull as a whole. We've been discussing individual bones, but they don't exist in isolation. They fit together like pieces of a three-dimensional puzzle, each one precisely shaped to meet its neighbours. The joints between these bones are called sutures, and they look like jagged lines or cracks running across the skull. Sutures are not arbitrary. They're positioned along stress lines, helping to distribute forces across the skull. They also allow for a small amount of flexibility. When you're a newborn, these sutures are wide and flexible, separated by soft spots called fontanelles. This flexibility allows your skull to compress slightly during birth, squeezing through the birth canal without fracturing. Over time, the bones grow together, the fontanelles close, and the sutures become tighter, though they never fuse completely. Even in an adult skull, there's a thin layer of fibrous tissue between the bones. The main sutures have names that describe their locations. The coronal suture runs across the top of your head from ear to ear, joining the frontal bone to the two parietal bones. The sagittal suture runs front to back along the top of your skull, joining the two parietal bones to each other. The lambdoid suture runs across the back of your head, joining the parietal bones to the occipital bone. These names come from their shapes or positions. Coronal from crown, sagittal from arrow, and lambdoid because it looks like the Greek letter lambda. Let's talk about the parietal bones for a moment, since they cover a large portion of your skull. You have two of them, left and right, forming the sides and roof of your cranium. They're shaped like curved plates, and together they create the dome of your skull. The word parietal comes from the Latin word for wall, which is fitting since these bones form the walls of your cranial cavity. The parietal bones are where the top of your head is, the part that would get rained on if you weren't wearing a hat. They're also where babies have their fontanelles. The anterior fontanelle, that soft spot you're always warned about, sits where the frontal bone and the two parietal bones will eventually meet. It usually closes by the time a child is 18 months old, though the bones themselves don't completely fuse until much later. At the back of your skull is the occipital bone, forming the base and back of your cranium. This bone surrounds the foramen magnum, a large opening through which your spinal cord passes to become your brainstem. Foramen magnum means great hole, and it's aptly named. This is the most important opening in your skull, the passageway through which your brain communicates with the rest of your body. The occipital bone also features two rounded protrusions called occipital condyles, which articulate with the first vertebra of your spine. These condyles allow you to nod your head yes. The joint between your skull and spine is designed primarily for forward and backward movement. Side-to-side movement, shaking your head no, happens at the joint between the first and second vertebrae, just below. At the base of your skull, hidden from view, is a complex landscape of openings, grooves, and projections. This is where nerves and blood vessels enter and exit your skull. The carotid arteries, which supply blood to your brain, enter through the carotid canals. The internal jugular veins, which drain blood from your brain, exit through the jugular foramina. 12 pairs of cranial nerves emerge from your brainstem and exit through various foramina in the base of your skull, each one traveling to a specific destination. These cranial nerves control everything from your sense of smell to your ability to swallow. The olfactory nerve, which we mentioned earlier, passes through the cribriform plate of the ethmoid bone. The optic nerve passes through the optic canal in the sphenoid. The trigeminal nerve, which provides sensation to your face and controls your chewing muscles, exits through several different foramina. The facial nerve, which controls your facial expressions, exits through the stylomastoid foramen in the temporal bone, and so on, through all 12 pairs. The base of the skull is also where your skull articulates with your spine, where the hard protective shell of your cranium transitions into the flexible column of your vertebrae. This transition zone is critical. Your skull must be stable enough to protect your brain, but must also allow for the mobility of your neck. The balance is achieved through a series of strong ligaments and precisely shaped joints. Let's consider for a moment what your skull is actually protecting. Inside this bony case is your brain, of course. About 3 pounds of tissue that controls everything you do, everything you think, and everything you are. But there's more. Between your brain and your skull are 3 layers of membrane called meninges. The outermost layer, the dura mater, is tough and leathery, clinging to the inside of your skull. The middle layer, the arachnoid mater, is delicate and web-like. The innermost layer, the pia mater, is thin and transparent, following every curve and fold of your brain's surface. Between the arachnoid mater and pia mater is a space filled with cerebrospinal fluid. This fluid acts as a cushion, allowing your brain to float inside your skull. When your head moves suddenly, your brain doesn't slam against the inside of your skull. Instead, it moves through the cushioning fluid. This is why you can shake your head vigorously without damaging your brain, and it's also why severe head injuries can be so devastating. The cushioning system has limits. The bones of your skull also contain air spaces, the sinuses we mentioned earlier. You have 4 pairs of sinuses: the frontal sinuses in your forehead, the maxillary sinuses in your cheeks, the ethmoid sinuses between your eyes, and the sphenoid sinuses deep in the center of your head. These air-filled cavities make your skull lighter and also warm and humidify the air you breathe. They're lined with mucous membrane, constantly producing a thin layer of mucus that traps dust, bacteria, and other particles. When your sinuses become inflamed, sinusitis, those normally clear passages become blocked. Pressure builds up, causing pain. The location of the pain tells you which sinuses are affected. Frontal sinuses cause forehead pain. Maxillary sinuses cause cheek pain and upper tooth pain. Ethmoid sinuses cause pain between your eyes. Sphenoid sinuses cause pain deep in your head or behind your eyes. Here's an interesting fact about sinuses. They're not present at birth. Babies are born with minimal or no sinus cavities. These spaces develop as you grow, expanding as your facial bones grow. The maxillary sinuses are present at birth but tiny. The frontal sinuses don't begin to develop until you're around 2 years old, and they don't reach full size until you're a teenager. The sphenoid and ethmoid sinuses develop gradually throughout childhood. This is why young children are less prone to sinusitis than adults. They simply have less sinus space to become infected. Let's talk about sexual dimorphism in the skull. Male and female skulls are different, though the differences are subtle and not absolute. Male skulls tend to be larger overall, with more prominent features. The brow ridge, that bony shelf above the eyes, is usually more pronounced in males. The mastoid process, that bump behind the ear, is typically larger in males. The jaw is often more robust in males, with a more squared-off chin and larger, more prominent gonial angles, those corners where the horizontal body of the mandible meets the vertical rami. Female skulls tend to be smaller and smoother, with less pronounced features. The forehead is often more vertical, the jaw more gracile, and the chin more pointed. But these are tendencies, not rules. There's a lot of overlap between male and female skulls, and it's not always possible to determine sex from the skull alone, especially in cases where the skull is incomplete or the individual was young. Forensic anthropologists use these differences, along with measurements and statistical analyses, to estimate sex from skeletal remains. But they're careful to acknowledge the uncertainty involved. The skull can suggest whether someone was likely male or female, but it rarely provides definitive proof. Other bones, particularly the pelvis, are more reliable for determining sex. Age can also be estimated from the skull, though again with limitations. In infants and children, the stages of tooth eruption and bone fusion provide reasonably accurate age estimates. In adults, the picture becomes murkier. The sutures of the skull gradually fuse with age, progressing from completely open in youth to partially or completely obliterated in old age. The teeth show wear patterns that accumulate over time, but these changes are highly variable, influenced by diet, health, and individual factors. Ancestry can sometimes be inferred from skull features, though this is controversial territory. Certain measurements and characteristics show statistical patterns across populations. For example, the shape of the nasal opening, the projection of the jaw, and the shape of the eye, orbits, show population-level variations. But these are patterns, not absolutes, and there's enormous variation within populations and overlap between populations. Modern forensic anthropology is moving away from rigid racial classifications toward more nuanced understandings of human variation. Your skull also bears witness to your life experiences. Healed fractures leave visible marks. Dental work is obvious. Diseases that affect bone, things like Paget's disease, which causes abnormal bone remodeling, or multiple myeloma, which causes holes in the skull, leave characteristic signatures. Nutritional deficiencies during childhood can cause changes in bone structure that persist into adulthood. Even your habits leave marks. If you habitually clench your jaw, the attachment sites for your chewing muscles may become enlarged and roughened. If you're a musician who plays certain instruments, the way you hold the instrument may affect your teeth and jaw. Life writes itself onto bone, subtle but permanent. Let's consider the evolution of the human skull. If you look at the skull of an early hominin, say Australopithecus afarensis, who lived about 3 million years ago, you'd notice several striking differences from a modern human skull. The face would project forward much more, with a much larger jaw and teeth. The cranium would be smaller, with a brain case holding a brain about 1/3 the size of yours. The brow ridges would be more prominent. The forehead would slope backward rather than rising vertically. Over millions of years, our skulls have changed dramatically. The cranium has expanded to house a larger brain. The face has become flatter, less prognathic. The teeth have become smaller. The jaw has become lighter and more gracile. The brow ridges have reduced. These changes reflect changes in diet, in brain size, in social behavior, and in language. The expansion of the cranium is particularly striking. Brain size tripled over the course of human evolution, from about 400 cubic centimeters in early hominins to about 1,300 cubic centimeters in modern humans. This required significant remodeling of the skull. The cranial vault had to expand upward and backward. The base of the skull had to flex, tucking under the cranium rather than extending straight back. These changes allowed for a larger brain while still maintaining a birth canal that babies could pass through. Though even with these adaptations, human birth is difficult compared to other primates. The flattening of the face is related to changes in diet. As our ancestors began using tools to process food, cutting meat, cooking tough plant material, the selective pressure for large teeth and powerful jaws decreased. Smaller teeth and lighter jaws were sufficient, and they became the norm. This also affected the shape of the skull. A protruding face requires a different structural configuration than a flat face. As our faces flattened, other features changed in response. The reduction of brow ridges is less clearly understood. These prominent shelves of bone may have served structural functions, helping to dissipate chewing forces. They may have served social functions, making faces more expressive or intimidating. Or they may have simply been byproducts of other changes in skull architecture. As our faces flattened and our foreheads became more vertical, the brow ridges became less prominent, eventually reducing to the modest eyebrow arches we have today. Language almost certainly played a role in the evolution of our skulls. Speech requires precise control of airflow, of tongue position, and of vocal cord tension. The base of the human skull is flexed in a way that creates an expanded pharynx. the space at the back of the throat. This expanded pharynx allows for a wider range of sounds. Our larynx sits lower in the throat than in other primates, which increases the range of our vocal production, but also means we're more prone to choking. That's the trade-off we made for language. Let's talk about pathology for a bit, the things that can go wrong with the skull. Fractures are common, unfortunately. The skull can usually withstand a fair amount of impact, but it has limits. Fractures can be linear, simple cracks that don't displace the bone, or they can be depressed, where fragments of bone are pushed inward toward the brain. Depressed fractures are more serious because they can damage the underlying brain tissue. The skull also develops tumours, both benign and malignant. Osteomas are benign tumours of bone tissue that can grow on the skull, sometimes large enough to be visible and palpable as bumps under the skin. They're usually harmless unless they're located somewhere that they press on vital structures. Malignant tumours can develop in the skull itself, or can metastasize to the skull from cancers elsewhere in the body. Infections of the skull are less common in modern times thanks to antibiotics, but they still occur. Osteomyelitis is an infection of the bone itself, usually caused by bacteria. It can be extremely difficult to treat because bone tissue doesn't have a rich blood supply, so antibiotics have trouble reaching the infected area in sufficient concentration. Congenital conditions affecting the skull range from mild to severe. Craniosynostosis is a condition where one or more of the cranial sutures fuse prematurely before the brain has finished growing. This can cause the skull to develop an abnormal shape and can also restrict brain growth if not corrected surgically. There are different types depending on which suture is affected. Sagittal synostosis, where the sagittal suture fuses early, causes the skull to become long and narrow. Coronal synostosis causes a flattened forehead on one or both sides. Cleft lip and cleft palate are relatively common congenital conditions affecting the face. They occur when the tissues that form the lip and palate don't fuse completely during development. The result is a gap or opening. These conditions can be surgically repaired, usually in infancy, with excellent results in most cases. Let's shift to something more philosophical. Your face is your primary interface with the social world. It's how people recognize you, how you express emotions, and how you communicate without words. Every human face is unique. Even identical twins have subtle differences that close observers can detect. This uniqueness arises from the subtle variations in how your facial bones are shaped and how they fit together. Facial recognition is one of the most sophisticated things your brain does. You have areas in your brain specifically dedicated to processing faces, recognizing them, and reading the emotions expressed by them. You can recognize a familiar face in a fraction of a second, even if you haven't seen that face in years, even if the face has aged or changed. This ability is so fundamental that it's almost invisible to us, but it's actually quite remarkable. Your face is also incredibly expressive. You have dozens of muscles attached to your skull and to each other, and these muscles can contract in thousands of different combinations to create expressions. Some of these expressions are universal. People from every culture recognize happiness, sadness, fear, anger, disgust, and surprise when they see them on a face. Other expressions are more subtle or culturally specific. The bones of your skull provide anchor points for these facial muscles. The zygomatic bone, your cheekbone, is where several muscles attach that control your smile. The mandible is where the muscles that close your jaw attach. The temporal bone provides attachment for muscles that move your jaw and help you chew. Without these bony anchor points, your facial muscles would have nothing to pull against, and you'd have no facial expressions at all. Think about how much information you extract from a face. You can tell if someone is happy, sad, angry, or afraid. You can tell if they're sincere or lying, though not as reliably as you might think. You can tell if they're paying attention to you or looking past you. You can gauge their age, roughly. You can make guesses about their health, their emotional state, and their intentions. All of this from the arrangement of features on the front of the skull, from the movements of muscles attached to bone. Faces are so important to us that we see them where they don't exist. We see faces in clouds, in toast, and in the front of cars. The phenomenon is called pareidolia, the tendency to perceive patterns, particularly faces, in random or ambiguous stimuli. It happens because your brain is so primed to detect faces that it sometimes detects them even when they're not there. This has evolutionary logic. Missing a face could be dangerous. Seeing a face that isn't there is relatively harmless. Your skull also houses your special senses, the senses that give you information about the world at a distance. Your eyes sit in their protective orbits. Your ears are built into your temporal bones. Your nose is a passage carved through multiple bones, and your tongue rests against your hard palate. 4 of your 5 senses, all except touch, are located in your head, and all 4 depend on structures in or on your skull. Vision begins with light entering through your cornea, passing through your lens, and focusing on your retina at the back of your eye. But the orbit itself, the bony socket, provides protection and structure. The optic nerve exits through the back of the orbit, passing through the optic canal in the sphenoid bone, carrying visual information to your brain. The muscles that move your eye attach to the walls of the orbit, allowing you to look left, right, up, down, and at all the angles in between. Hearing is perhaps the most elaborately engineered sense. Sound waves enter your ear canal, strike your eardrum, and cause it to vibrate. These vibrations are transmitted through 3 tiny bones in your middle ear, the malleus, incus, and stapes, collectively known as the ossicles. These are the smallest bones in your body, and they sit in a cavity within your temporal bone. From the ossicles, the vibrations pass to your cochlea, a spiral-shaped structure in your inner ear, where they're converted into electrical signals that your brain interprets as sound. The temporal bone also houses your vestibular system, the organs of balance. These fluid-filled structures detect the position and movement of your head, helping you maintain your balance and orient yourself in space. When you spin around and then stop, the fluid in your semicircular canals keeps moving for a moment, sending signals to your brain that you're still spinning. That's why you feel dizzy. Smell begins in your nasal cavity, where odor molecules dissolve in the mucus coating your olfactory epithelium, a small patch of tissue high up in your nose. The olfactory receptor cells send their signals through the cribriform plate of the ethmoid bone, those tiny holes we mentioned earlier, directly to your olfactory bulb at the base of your brain. Smell is unique among your senses because it bypasses much of the usual sensory processing. Most senses have to pass through several relay stations before reaching the parts of your brain that process conscious perception. Smell goes almost directly to areas involved in emotion and memory, which is why sense can trigger memories so powerfully, so unexpectedly. Taste begins on your tongue, but it's intimately connected with smell. What you think of as taste is actually a combination of taste and smell. Your tongue can detect only 5 basic tastes: sweet, salty, sour, bitter, and umami. Everything else, the difference between an apple and a pear, between coffee and tea, comes from smell. When you have a cold and can't smell properly, food seems to lose its flavour. You're still tasting, but without smell, taste alone is quite limited. Your tongue rests against your hard palate, and the shape of this palate affects how you speak. The hard palate provides a surface against which your tongue can press to create different sounds. The alveolar ridge, that bumpy area right behind your upper front teeth, is particularly important. Many speech sounds are created by pressing your tongue against the alveolar ridge, T, D, N, S, Z, L, and others. Without this bony ridge, these sounds would be difficult or impossible to produce. Speech is a remarkable thing when you think about it. You're taking air from your lungs, passing it through your larynx to create sound, then shaping that sound with your tongue, lips, teeth, and palate to create distinct sounds that represent ideas. The bones of your skull provide the framework for much of this system. Your teeth provide surfaces for your tongue to press against. Your hard palate provides a resonating chamber and a surface for articulation. Your jaw provides the mobility necessary to shape sounds. Different languages use the anatomy of the skull in different ways. Some languages use sounds that English doesn't have. Clicks produced by the tongue against the palate. Ejectives produced by closing the glottis and then releasing it, and sounds produced far back in the throat. Your skull has the anatomical potential to produce all of these sounds, but whether you actually use them depends on which language you learned as a child, when your brain was most plastic and your speech patterns were being established. Let's talk about aging for a moment. Your skull changes throughout your life, though the changes are less dramatic after childhood. In infancy and childhood, as we've mentioned, the skull is growing rapidly. The sutures are open, the fontanelles are closing, and the teeth are erupting. By your early 20s, your skull has reached its adult size and configuration. The sutures are tight, and all your permanent teeth are in place, or at least they've tried to come in, whether or not there was room for them. But aging doesn't stop there. Throughout adulthood, your skull continues to change, albeit slowly. The sutures gradually fuse more completely. The bones themselves undergo constant remodeling. Old bone is broken down and new bone is formed. This remodeling continues throughout life, though the balance shifts. In youth, you build more bone than you break down. In middle age, the processes are roughly balanced. In old age, you tend to break down more bone than you build, leading to a gradual decrease in bone density. Your teeth wear down with use. If you live long enough and don't have dental work done, your teeth can wear down to the point where the crown is gone and you're chewing on exposed dentin. This was much more common in the past, when diets were coarser and dental care was minimal. Archaeological skulls from pre-industrial populations often show severe tooth wear. As you age, you may also lose teeth. When you lose a tooth, the alveolar bone that once supported it begins to resorb, to disappear. Without the tooth to provide stimulation, the bone is no longer needed, and your body breaks it down and redistributes the minerals elsewhere. This is why people who have lost multiple teeth often have a sunken appearance around their mouth. The bone that once supported their teeth is gone, and the soft tissue has collapsed inward. The maxillary sinuses can also change with age. As the alveolar bone resorbs, the floor of the maxillary sinus can extend downward, occupying space that once held tooth roots. This is something dentists have to be careful about when extracting upper teeth or placing dental implants. The maxillary sinus is right there, separated from the tooth socket by only a thin layer of bone. If that bone is breached during a dental procedure, it can create a connection between the mouth and the sinus, which is uncomfortable and requires surgical repair. Your face also changes shape as you age, though this is due more to soft tissue changes than to changes in bone. The skin loses elasticity, fat pads shift and shrink, and muscles lose tone. But the bones provide the framework on which all these changes occur. A face with strong, prominent cheekbones may age differently than a face with less prominent cheekbones, simply because the bone structure provides different support for the overlying tissues. Here's something interesting. Your skull is not a closed system. Blood vessels enter and exit through various foramina, as we've discussed. But there's also communication between the inside and outside through the sinuses and through the cribriform plate. This means that infections in your nasal cavity or sinuses can potentially spread to your brain. It's rare, thanks to modern antibiotics, but it can happen. Similarly, trauma to the face can sometimes result in brain injury if the force is transmitted through the bones. The bones of your skull are also connected to the bones of your spine and through your spine to the rest of your skeleton. When you walk, the impact travels up through your legs, through your spine, and into your skull. Your skull has to absorb these forces without allowing them to damage your brain. The cervical spine, your neck, acts as a shock absorber, allowing your head to move independently of your body, cushioning impacts. The muscles of your neck attach to your skull at various points, particularly to the occipital bone at the base of your skull. These muscles are strong. They have to be to support the weight of your head, which is considerable. Your head weighs about 10 to 12 pounds, and it sits on top of a relatively slender column of vertebrae. The muscles have to work constantly to keep your head balanced and upright. When these neck muscles become tense or fatigued, you get a tension headache. The muscles refer pain to other areas, and you feel it as a dull ache around your skull, particularly at the base and around the back of your head. This is one of the most common types of headache, and it's directly related to the interaction between your skull and the muscles attached to it. Let's consider the concept of beauty for a moment. Ideas about what makes a face attractive vary across cultures and time periods, but there are some commonalities. Symmetry is generally considered attractive. A face where the left side mirrors the right side tends to be rated as more attractive than an asymmetrical face. This makes biological sense. Symmetry suggests developmental stability, lack of disease, or injury. Certain proportions also seem to be universally attractive. The golden ratio, approximately 1.618 to 1, appears in faces that are rated as attractive. This ratio can be found in the relationship between the width of the face and its length, between the distance between the eyes and the width of the face, and between various other facial measurements. Whether this is hardwired into human perception or is a learned cultural preference is still debated. The bones of your skull determine these proportions to a large extent. The width of your face is determined by your zygomatic bones and your mandible. The height is determined by the length of your maxilla and mandible. The distance between your eyes is determined by the width of your nasal cavity and the ethmoid bone between your orbits. All of these measurements are set by your skeletal structure. Soft tissue can modify them to some degree, but the underlying bone is the foundation. Cosmetic surgery, when it involves the face, often involves modifying bone. Rhinoplasty, nose reshaping, often involves removing or reshaping nasal bone and cartilage. Genioplasty, chin surgery, involves cutting the mandible and repositioning the chin portion. Orbital surgery can reposition or reshape the eye sockets. Jaw surgery can advance or reduce the mandible or maxilla. These procedures acknowledge that the skeleton is the foundation of facial appearance. Let's talk about injury and repair. When you fracture a bone in your skull, your body responds the same way it does to fractures elsewhere in your body. Blood vessels at the fracture site rupture, forming a hematoma, a collection of blood. This hematoma becomes a scaffold for repair. Cells called fibroblasts move in and create a soft callus of fibrous tissue. Then cells called osteoblasts begin depositing new bone, gradually replacing the soft callus with hard callus, new bone tissue. Over time, the hard callus is remodeled. Osteoclasts break down excess bone, while osteoblasts continue to deposit new bone in the right locations. Eventually, the fracture site is healed, though there's usually a visible line or thickening where the break occurred. In X-rays of old skulls, healed fractures are often visible as lines of denser bone. Some skull fractures heal without intervention. Linear fractures, simple cracks, often heal on their own if there's no displacement and no underlying brain injury. Depressed fractures, where bone fragments are pushed inward, usually require surgery to elevate the fragments and ensure they don't damage the brain. Fractures that cross the path of an important blood vessel may require urgent surgery to prevent life-threatening bleeding. The skull also shows evidence of ancient medical procedures. Trepanation, drilling or cutting a hole in the skull, is one of the oldest surgical procedures known. Skulls showing trepanation have been found from many different cultures and time periods, some dating back thousands of years. The reasons for trepanation varied. Sometimes it was done to relieve pressure from bleeding or swelling inside the skull. Sometimes it seems to have been done for ritual or religious reasons. What's remarkable is that many of these individuals survived. You can tell because the bone shows signs of healing, new bone growth around the edges of the hole. Some skulls show multiple trepanation holes, suggesting the procedure was done more than once. These ancient surgeons didn't have anesthesia, they didn't have antibiotics, and they didn't have sterile technique, yet many of their patients survived. It speaks to the resilience of the human body and perhaps also to some degree of anatomical knowledge on the part of these early surgeons. Modern neurosurgery, of course, is far more sophisticated. Surgeons can remove sections of the skull, a procedure called a craniotomy, to access the brain for tumour removal, aneurysm clipping, or other procedures. After the surgery, the bone is replaced and secured with plates and screws. Sometimes, if the bone is damaged or infected, it's not replaced immediately. The patient lives with a defect in their skull, covered only by soft tissue, until a later surgery can replace the bone with either their own bone once it's healed, or with a synthetic plate. Let's consider the forensic applications of skull anatomy. When human remains are found and need to be identified, the skull is one of the most informative parts of the skeleton. As we mentioned earlier, the skull can provide information about sex, age, ancestry, and individual characteristics. But it can also be used for facial reconstruction. Facial reconstruction is the process of building a face onto a skull, either physically using clay and other materials or digitally using computer modelling. The reconstructor uses knowledge of soft tissue depths at various points on the skull, how thick the soft tissue is over the frontal bone, over the zygomatic bones, over the mandible, and so on. These depths vary based on sex, age, body build, and ancestry, but average values have been established through studies of living people and cadavers. Starting with the skull, the reconstructor builds up soft tissue to the appropriate depths, then sculpts facial features. The position and size of the nose can be estimated from the nasal opening. The position of the mouth is determined by the teeth. The shape of the eyes is influenced by the orbits. The result is never exact. There's too much that soft tissue contributes that bone alone can't tell you, but it can be close enough to help identify someone or to give investigators an idea of what the person looked like. Superimposition is another forensic technique. If there's a photograph of a missing person, the skull can be digitally superimposed over the photograph to see if they match. The fit of anatomical landmarks, the position of the eye sockets, the shape of the nasal opening, and the angle of the jaw can suggest whether the skull belongs to the person in the photograph. DNA analysis has made some of these techniques less critical for identification, but they're still valuable, especially in historical cases or when DNA is degraded. And facial reconstruction serves another purpose beyond identification. It humanizes the remains. A skull is a scientific specimen. A face, even a reconstructed one, is a person. Your skull also preserves isotopic signatures that can tell researchers where you grew up. The minerals in your tooth enamel, which forms during childhood, Incorporate isotopes from the water you drank and the food you ate. These isotopes vary geographically, so by analysing the isotopes in your teeth, researchers can determine where you spent your childhood, sometimes with remarkable precision. This technique has been used to track ancient migrations, to identify travellers and traders in archaeological contexts, and to understand the geographic origins of unidentified remains. Your skull quite literally contains the story of where you've been. Let's return to evolution once more. The human skull is a compromise between competing demands. It needs to be large enough to house a big brain. It needs to provide strong attachment points for chewing muscles. It needs to protect vital sensory organs. It needs to be light enough that you can hold your head up without your neck muscles fatiguing. It needs to allow for a birth canal wide enough for babies to pass through, which is challenging when babies have such large heads. The solution evolution arrived at is not perfect. Human birth is difficult and risky compared to birth in other primates, precisely because of the size of our heads relative to the birth canal. Babies are born relatively helpless, with much of their brain development still ahead of them, because if they developed much more in the womb, their heads would be too large to be born at all. Our sinuses, which make our skull lighter, also make us prone to sinus infections. Our teeth, which became smaller as our diet changed, often don't fit properly in our jaws, leading to impaction and crowding. Our temporomandibular joints, which allow for versatile jaw movement, are prone to dysfunction and pain. Our larynx, positioned low for speech, makes us prone to choking. Evolution doesn't create perfection. It creates workable solutions with trade-offs. But despite these imperfections, the human skull is a marvel of engineering. It protects your brain, one of the most complex structures known, within a case that weighs only about 2 pounds. It provides a framework for your face, allowing you to eat, breathe, see, hear, smell, and communicate. It houses your special senses and provides openings for nerves and blood vessels. It grows with you, adapts to your use patterns, heals when injured, and lasts for your entire life and beyond. Think about what your skull does every day. It protects your brain from countless minor impacts, bumping your head on a cabinet, lying down on a pillow, resting your head on your hand. It supports the weight of your face and allows your jaw to move thousands of times as you chew, speak, and swallow. It provides attachment points for dozens of muscles. It allows air, light, and sound to enter your body while keeping pathogens and foreign objects mostly out. And it does all of this quietly, unnoticed, and unappreciated most of the time. You're aware of your skull only when something goes wrong: a headache, a toothache, a sinus infection, or an injury. The rest of the time, it's just there, doing its job, holding your face together, cradling your brain, and providing structure and protection. Consider the complexity of what we've discussed tonight. 22 separate bones, each with its own shape, its own name, its own developmental trajectory, and its own function. Bones that began as separate islands of cartilage in your developing embryo, gradually hardening, gradually meeting, eventually fusing into the structure you have now. Bones shaped by millions of years of evolution, by the demands of big brains and small faces, and by the needs of speech and chewing and breathing and seeing. Each of these bones has a story. The frontal bone, forming the curve of your forehead and containing your frontal sinuses. The parietal bones form the dome of your skull. The temporal bones house your ears and provide attachment for jaw muscles. The occipital bone surrounds the great foramen through which your spinal cord passes. The sphenoid is wedged in the center like a keystone. The ethmoid, perforated like a sieve for your olfactory nerves. The zygomatic bones give your face its width. The maxilla, holding your upper teeth. The mandible is the only moving bone in your skull. The nasal bones form the bridge of your nose. The lacrimal bones, channeling your tears. The palatine bones and vomer, hidden from view but essential to function. And then the sutures connecting them all, those jagged lines that look like cracks but are actually joints, fibrous connections that allow for flexibility while providing stability. The coronal suture, the sagittal suture, the lambdoid suture, and others with names less commonly remembered but no less important. Consider also what your skull represents in human culture. The skull is a symbol of mortality, appearing in art and literature from every culture. Memento mori. Remember that you must die. The skull reminds us that beneath our faces, beneath our individual features, we're all the same. Bone and hollow spaces and foramina for nerves. But the skull is also a symbol of identity. It's what remains when everything else is gone. It's what archaeologists find buried in ancient tombs. It's what allows us to identify remains, to understand past populations, and to trace human history. Your skull will outlast everything else about you, persisting long after your soft tissue has decayed, a testament to your existence, a record written in bone. The skull appears in religious and spiritual contexts as well, as a symbol of transformation, of the transition from life to death. As an object of veneration in some traditions, where the skulls of ancestors or saints are preserved and honoured, as a reminder of impermanence, of the temporary nature of physical existence. And yet, for all this symbolism, your skull is also profoundly practical. It's not a symbol, it's a thing, a physical object with weight and dimensions and material properties. It's bone tissue made primarily of calcium and phosphate, arranged in a specific architecture that provides strength while minimizing weight. It's a product of your genetics, your development, and your environment. Your skull is unique to you. The exact shape of your frontal bone, the precise angle of your jaw, the specific spacing of your teeth, and the particular configuration of your sinuses, these details are yours alone. Even identical twins who share the same DNA have skulls that differ in small ways due to slight differences in development and environment. And your skull changes with you. It grows with you in childhood, changes shape subtly throughout your life, and records your injuries and your habits, your dental work, and your health conditions. It's a record of your life written in bone, a physical autobiography that you carry with you always. We've been talking for a while now about bones and foramina and sutures, about evolution and development and forensics. Perhaps it's becoming clear why this was titled a boring lecture. There's something inherently tedious about listing bones and describing their positions, their articulations, and their functions. It's the kind of material that medical students memorize through sheer force of will, drilling themselves with flashcards and cadaver specimens until the information sticks. And yet, there's also something profound about it. This is your body we're talking about. These are the bones that protect your brain, that support your face, that make it possible for you to chew and breathe and speak and express emotion. This is the architecture of your head, the framework on which your identity is built. Every face you've ever seen, every person you've ever met, has had this same basic architecture. 22 bones arranged in the same general configuration, with individual variations that make each face unique. When you look at someone, you're seeing the soft tissue draped over this bony framework. You're seeing the expression created by muscles pulling on bone. You're seeing the face that's built on this foundation. And when you talk to someone, when you watch their expressions change as they speak, when you notice the way their eyes crinkle when they smile, or the way their jaw clenches when they're angry, you're watching the interaction between soft tissue and bone. You're watching muscles contract and relax, pulling on the bones of the skull, creating the infinite variations of human expression. The skull is the interface between inside and outside, between mind and world. It's where your brain, locked away in protective bone, receives information from the outside through specialized sense organs. It's where your thoughts become actions through the motor nerves that control your facial expressions and your speech. It's where the internal and external meet. And it's worth considering that this elaborate structure, this arrangement of 22 bones with all their complexity, exists for one primary purpose: to protect about 3 pounds of tissue that makes you who you are. Your brain, with all its thoughts and memories and personality and consciousness, sits inside this bony case. Everything else about the skull, the face, the jaw, the sinuses, the orbits, is secondary to that primary protective function. The evolution of the human skull is largely the story of the evolution of the human brain. As brain size increased over millions of years, the skull had to expand to accommodate it. The cranium grew upward and backward. The face became smaller and tucked under the cranium. The foramen magnum shifted to a position more directly underneath the skull, allowing upright posture. All of these changes were driven by the increasing size of the brain. And what a brain it is, this organ that required such an elaborate protective case. The human brain is what allows you to listen to lectures about skulls, to understand anatomy, and to appreciate the complexity of your own structure. It's what allows you to think about thinking, to be conscious of consciousness, and to study the very organ that makes study possible. Your skull, then, is not just a collection of bones. It's the case that houses the organ of consciousness. It's the structure that makes you possible. Without it, your brain would be defenseless, vulnerable to the slightest injury. Without it, your face would have no structure, no framework. Without it, you couldn't chew or breathe properly, or see or hear or smell. And all of this complexity, all of these bones and sutures and foramina and sinuses developed from a few patches of tissue in an embryo. Within 8 weeks of conception, the basic structure of your skull was already present, though made of cartilage rather than bone. By birth, many of the bones had begun to ossify, though they were still separated by soft spots and flexible sutures. Throughout childhood, the bones continued to grow and harden and fuse. And now, here you are, with a fully formed adult skull, the culmination of years of growth and development. It's easy to take it for granted. Your skull is always there, always doing its job, and most of the time you're not aware of it at all. But perhaps tonight, as you drift towards sleep, you'll be just a bit more aware of the structure of your head, the bones pressing against your pillow. The jaw relaxes as your chewing muscles release their tension. The slow rhythm of breathing through passages carved through bone. The soft pulse of blood flowing through foramina at the base of your skull. These are the quiet processes that continue while you sleep, the automatic functions that your body performs without conscious thought. Your skull continues to protect your brain, to support your face, and to provide structure and form. And tomorrow when you wake, when you look in the mirror and see your face looking back, perhaps you'll see it a bit differently. Not just as a face, but as the visible expression of underlying bone, of evolution, of development, of individual variation. Your face is your skull, made visible through soft tissue. Every feature is shaped by the bones beneath. The curves and angles, the proportions and symmetries, they're all determined by the architecture we've been discussing. And that architecture, those 22 bones, is both universal and unique. Universal because all human skulls share the same basic structure. Unique because the specific details of your skull belong to you alone. So that's your skull. 22 bones. Numerous foramina and canals and processes. Sinuses and sutures and articulations. A structure that's both incredibly complex and elegantly simple. A product of evolution that's both ancient and personal. a framework that's both structural and symbolic. It's there now, of course, the same as always, doing its job, protecting and supporting and providing form. But perhaps now you understand it a bit better. Perhaps now, as you settle into sleep, you can appreciate the quiet marvel of your own anatomy, the intricate architecture of your skull, and the bones that make you possible. And with that thought, with that awareness of structure and function, of evolution and development, of the profound and the mundane all wrapped together in the bones of your head, perhaps you can let the day's thoughts settle, let the words drift away, and simply rest, cradled safely within your own skeletal architecture, protected by bone that's been millions of years in the making and a lifetime in the growing. Sleep well, with the quiet knowledge that you are wonderfully, intricately made. Close your eyes for a moment, not to sleep, not yet, but to imagine. Picture yourself as you were this morning. Perhaps you woke naturally, or maybe an alarm pulled you from wherever you'd gone. Either way, you returned. You came back from a place that has no geography, no zip code, and no GPS coordinates. You came back from sleep. We spend roughly a third of our lives doing this. A third. If you live to 80, that's about 26 years spent unconscious, lying down, breathing slowly, with your eyes closed and your mind wandering through landscapes that dissolve the moment you try to remember them. 26 years. It seems almost wasteful, doesn't it? Like some cosmic design flaw. Imagine what you could accomplish with an extra 8 hours every day. The books you could read, the skills you could learn, the conversations you could have, and yet, here we are. Every creature with a nervous system does some version of this. Dolphins sleep with half their brain at a time. Birds can sleep mid-flight. Even fruit flies take what researchers call rest periods that look suspiciously like sleep. Evolution is ruthless. It doesn't keep things around just for fun. If sleep has survived this long, across millions of years and countless species, it must be doing something absolutely essential. But what exactly? That's the question we're going to explore tonight. Not with anxiety or urgency, but with curiosity. We're going to take our time, moving gently through the science and the poetry of sleep, understanding not just what happens when we close our eyes, but why it matters so profoundly. We're going to look at your brain, your body, your immune system, your memories, your emotions, all the invisible machinery that depends on those hours of darkness. So settle in, get comfortable. Let's begin this journey into one of the most mysterious and essential processes your body performs. Let's start with your brain. Right now, as you listen to these words, your brain is consuming about 20% of your body's total energy. That's remarkable when you consider that your brain makes up only about 2% of your body weight. It's an expensive organ to run. All day long it's firing neurons, processing information, making decisions, regulating your heartbeat and breathing, and keeping you balanced and aware and alive. Now imagine your brain is like a city. During the day it's bustling, traffic everywhere, people moving from place to place. Meetings are happening, transactions are being made, garbage accumulating on the streets. And yes, garbage is exactly the right word because your neurons produce waste. As they fire and communicate with each other, they generate metabolic byproducts, proteins and other molecules that build up in the spaces between your brain cells. One of these waste products is called beta amyloid. You might recognize that name. It's the protein that forms plaques in the brains of people with Alzheimer's disease. During the day, while you're awake and thinking and moving through the world, beta amyloid and other waste molecules accumulate in your brain tissue. They just sit there, building up, like newspapers piling up on a doorstep. So what happens at night? When you fall asleep, something extraordinary occurs. The glial cells in your brain, these are the support cells, the ones that aren't neurons but do all sorts of essential housekeeping, actually change shape. They shrink slightly, and in doing so, they open up the spaces between brain cells by about 60%. Suddenly, there's room for fluid to flow through. And it does. Cerebrospinal fluid, the clear liquid that cushions your brain and spinal cord, begins to pulse through your brain tissue in waves. It washes through these widened channels, collecting all that metabolic waste and all those accumulated proteins and flushing them out. The fluid carries this cellular garbage down and away, eventually filtering it into your bloodstream, where it can be processed and eliminated. This is called the glymphatic system, a play on lymphatic and glia, and it works most effectively when you're asleep. Scientists discovered this relatively recently in 2012 using 2-photon microscopy to watch the process happen in real time in the brains of living mice. It was beautiful and startling, seeing those waves of fluid washing through brain tissue, clearing away the debris of thought. Without this nightly cleaning process, the waste builds up. Day after day, the accumulation grows. And there's increasing evidence that this buildup is connected to neurodegenerative diseases. People who chronically don't get enough sleep have higher levels of beta amyloid in their brains. The connection between poor sleep and Alzheimer's risk isn't just correlation, there's a mechanistic link. Your brain needs those hours of darkness to take out the trash. Think about that for a moment. Every night, while you're lost in dreams or deep unconsciousness, your brain is performing essential maintenance. It's not idle. It's not wasting time. It's cleaning house, preparing for another day of thinking and feeling and being you. But the maintenance goes deeper than cleaning. Let's talk about what happens to your memories while you sleep. You've probably noticed that trying to memorize something when you're exhausted is nearly impossible. The words slide off your mind like water off glass. You read the same sentence 3 times and retain nothing. There's a reason for that. Your brain's ability to encode new memories, to take in fresh information and store it, depends on being well rested. But sleep doesn't just prepare you to make new memories. It actively processes the memories you've already made. During the day, when you experience something new, that information gets temporarily stored in a part of your brain called the hippocampus. Think of the hippocampus as a kind of inbox. It's great for short-term storage, for holding on to things just long enough to decide what to do with them. But it has limited capacity. If you kept everything in your inbox forever, it would overflow. You'd never find anything. So at night, during certain stages of sleep, particularly deep slow-wave sleep, your brain begins a process called memory consolidation. It's like a diligent office assistant going through that inbox, deciding what's important enough to file away permanently and what can be deleted. The hippocampus replays the day's experiences, sending them out to the cortex, the outer layer of your brain where long-term memories are stored. Neural patterns that were active during the day fire again during sleep, but faster, like someone pressing fast forward on a recording. These replay events happen over and over, strengthening the connections between neurons, making the memory more stable, more permanent, and more integrated with everything else you know. And here's the fascinating part. Your brain doesn't just replay everything randomly, it's selective. It prioritizes emotional memories and information you've been told is important. If you study something right before bed, your brain is more likely to consolidate that information during the night. Students who sleep after learning perform better on tests than students who stay awake, even if both groups have the same amount of total rest before the test. Sleep is also when your brain extracts patterns and insights from the information it's collected. There are countless stories of people solving problems in their sleep. scientists who wake up with the answer to an equation, writers who find the plot twist they'd been searching for, and musicians who hear a melody in a dream. This isn't magic or mysticism. It's your brain, freed from the constraints of conscious logic, making creative connections between disparate pieces of information. REM sleep, the stage where most vivid dreaming occurs, seems particularly important for this creative problem solving. During REM, your brain is almost as active as when you're awake, but the activity is different. The prefrontal cortex, which handles rational thought and executive function, is relatively quiet. Meanwhile, other areas light up, making unusual associations, connecting ideas that wouldn't normally come together. So when you sleep on a problem, you're not avoiding it. You're letting your brain work on it in a completely different way. Now let's shift from your brain to your body, because sleep doesn't just matter for cognition and memory, it matters for every system you have. Consider your immune system. You know the feeling, that scratchy throat, that first hint of a cold coming on, and all you want to do is crawl into bed and sleep for 12 hours. That instinct is ancient and wise. Sleep and immunity are deeply intertwined. When you sleep, your immune system goes into production mode. It manufactures cytokines. These are proteins that help fight infection and inflammation. Some cytokines also help promote sleep, creating a feedback loop. You get sick, the cytokines make you sleepy, you sleep more, and that extra sleep helps you produce more immune cells to fight off whatever's invaded your body. Studies have shown this connection clearly. Researchers exposed volunteers to rhinovirus, the common cold virus, and tracked who got sick. The people who had been sleeping less than 7 hours a night were about 3 times more likely to develop a cold than those sleeping 8 hours or more. Not a little more likely. 3 times. The same pattern shows up with vaccines. People who are sleep deprived when they get vaccinated produce fewer antibodies. Their bodies mount a weaker immune response. Sleep-deprived mice exposed to the influenza virus die at higher rates than well-rested mice. The connection is consistent and clear. Sleep is when your body builds and deploys its defenses. Part of this has to do with what happens to certain immune cells during sleep. T cells, which are crucial for fighting infections, become more effective when you're asleep. During sleep, T cells increase their expression of integrins, molecules that help them attach to infected cells and destroy them. When you're awake, stress hormones like adrenaline suppress this integrin expression. But when you sleep, those stress hormones drop, and your T cells become better hunters. It's elegant, really. Your body knows that nighttime, when you're safe and still and not expending energy on movement or thought, is the perfect time to redirect resources toward repair and defense. And repair is exactly what's happening throughout your body while you sleep. Let's talk about growth hormone for a moment. You might associate growth hormone with childhood, with getting taller, and with developing. But adults produce growth hormone too, and it plays essential roles in maintaining muscle mass, repairing tissue, and keeping your metabolism functioning properly. The majority of growth hormone secretion happens during deep sleep. When researchers deprive people of sleep, growth hormone production drops dramatically. This has real consequences. Chronic sleep deprivation leads to decreased muscle mass and increased fat accumulation, particularly around the abdomen. It makes it harder to build strength, harder to recover from exercise, and harder to maintain a healthy body composition. Athletes know this intuitively. Professional sports teams now employ sleep coaches. They track players' sleep patterns because they've learned that sleep is as important as training. A basketball player who sleeps 10 hours instead of 8 will have faster reaction times, better shooting accuracy, and improved endurance. A football player who gets adequate sleep is less likely to get injured. Sleep isn't recovery time. It is recovery. Your muscles don't actually get stronger when you work out. They get stronger when you rest afterward, particularly when you sleep. Exercise creates tiny tears in muscle fibers. During sleep, your body floods those muscles with growth hormone and other repair molecules, rebuilding the fibers thicker and stronger than before. Without adequate sleep, you're doing all the damage of exercise without giving your body the time and resources it needs to rebuild. The same goes for almost every tissue in your body. Your skin cells repair DNA damage from sun exposure while you sleep. Your gut lining, which turns over constantly, regenerates more effectively at night. Even your bones are remodeled during sleep, with old bone tissue being broken down and new bone being laid down in a carefully orchestrated process. Sleep is when your body becomes a construction site, rebuilding and repairing everything that wore down during the day. Let's turn to something that might surprise you: the relationship between sleep and your weight, your metabolism, and your hunger. There are two hormones you need to know about. One is called leptin, and it tells your brain you're full, you've had enough to eat. The other is called ghrelin, and it tells your brain you're hungry and it's time to find food. When you don't get enough sleep, leptin levels drop and ghrelin levels rise. Your body starts sending signals that you're starving, that you need more calories, even if you've eaten plenty. At the same time, the parts of your brain that make rational decisions about food become less active, while the parts that respond to pleasure and reward light up more intensely when they see high-calorie foods. So after a bad night's sleep, that donut looks more appealing. That bag of chips is harder to resist. It's not a failure of willpower, it's neurobiology. Your brain is responding to hormone signals that are telling it to seek out energy-dense food because resources are scarce. Except resources aren't scarce. You're just tired. Chronic sleep deprivation is associated with weight gain and obesity. People who sleep less than 6 hours a night are significantly more likely to have a higher body mass index. The relationship holds even when researchers control for diet and exercise. Sleep itself, or the lack of it, affects your metabolism. Part of this has to do with insulin sensitivity. Insulin is the hormone that helps your cells absorb glucose from your bloodstream. When you're sleep deprived, your cells become less responsive to insulin. Your pancreas has to produce more insulin to get the same effect. This is called insulin resistance, and it's the hallmark of type 2 diabetes. Studies have shown that just 1 week of sleeping 5 hours a night can reduce insulin sensitivity by up to 30%. Young, healthy volunteers with no history of metabolic problems can be pushed toward pre-diabetic states simply by restricting their sleep. And when they're allowed to sleep normally again, their insulin sensitivity returns to normal. The effect is reversible, but it's also very real. So if you've ever wondered why diet and exercise alone sometimes aren't enough, why the weight won't come off despite your best efforts, consider your sleep. It might be working against you in ways you didn't realize. Now we need to talk about your heart, your cardiovascular system, the network of vessels and valves and chambers that keeps blood flowing to every cell in your body. There's a natural experiment that happens twice a year in most countries. It's called daylight saving time. In the spring we lose an hour of sleep. In the fall we gain an hour. It's just 60 minutes. Not much, right? But researchers have found something remarkable. In the days following the springtime change, when people lose an hour of sleep, there's a measurable spike in heart attacks. About 24% more heart attacks occur on the Monday after we spring forward. And in the fall, when we gain an hour, there's a corresponding drop in heart attacks. 1 hour. That's all it takes to see a population-level effect on cardiovascular events. Chronic sleep deprivation has even clearer effects. People who regularly sleep less than 6 hours a night have a significantly higher risk of developing high blood pressure, having a heart attack, or having a stroke. The mechanisms are multiple. Sleep deprivation increases activation of the sympathetic nervous system, your fight or flight response, which keeps your heart rate elevated and your blood vessels constricted. Over time, this constant state of stress damages the cardiovascular system. Sleep deprivation also increases inflammation throughout the body. Inflammatory molecules circulate in your bloodstream, contributing to atherosclerosis, the buildup of plaques in your arteries. Your blood pressure doesn't dip at night the way it should, a pattern called non-dipping that's associated with worse cardiovascular outcomes. And there's another factor, sleep apnea. This is a condition where people stop breathing repeatedly during the night. Their airway collapses, oxygen levels drop, and they wake up just enough to gasp for air before falling back asleep. They often don't remember these awakenings, but they can happen dozens or even hundreds of times a night. Sleep apnea is strongly linked to high blood pressure, heart disease, and stroke. The repeated drops in oxygen stress the heart and blood vessels. The constant mini-awakenings prevent deep, restorative sleep. Many people have sleep apnea without knowing it, waking up feeling unrested year after year, not understanding why. Your heart needs rest too. During deep sleep, your heart rate slows, your blood pressure drops, and your cardiovascular system gets a break from the demands of keeping you upright and moving through the world. Without that break, it wears down faster. Let's shift gears and talk about emotions, about mood, about the surprising ways that sleep affects how you feel and how you respond to the world. Have you ever noticed that everything feels worse when you're tired? That small frustrations feel enormous? That you're more likely to snap at someone you love? More likely to cry at something that wouldn't normally bother you? Sleep and emotional regulation are intimately connected. The amygdala, a small almond-shaped structure deep in your brain, is crucial for processing emotions, particularly fear and threat. When you're well rested, your prefrontal cortex, the rational thinking part of your brain, keeps the amygdala in check. It provides context, perspective, and inhibition. But when you're sleep deprived, the connection between the prefrontal cortex and the amygdala weakens. The amygdala becomes hyperactive, responding more intensely to negative stimuli. At the same time, the prefrontal cortex, which would normally calm things down, becomes less effective. The result? You're more reactive, more emotional, more likely to perceive neutral faces as threatening, more likely to remember negative experiences and forget positive ones. Your emotional thermostat is turned up, and the mechanism for turning it back down isn't working properly. This has real implications for mental health. Insomnia and depression are so closely linked that it's often hard to tell which came first. They feed each other. Poor sleep worsens mood. Low mood disrupts sleep. The cycle spirals. But here's something hopeful. Treating sleep problems can improve depression. In clinical trials, cognitive behavioral therapy for insomnia, teaching people to sleep better, reduces symptoms of depression even when the therapy doesn't directly address mood. Better sleep, better mood. The connection runs both ways. Anxiety disorders show similar patterns. People with anxiety often have trouble falling asleep because their minds race with worries. And chronic sleep deprivation makes anxiety worse, lowering the threshold for fear responses, making it harder to extinguish learned fears, and creating a state of constant vigilance. REM sleep seems particularly important for emotional processing. During REM, your brain reactivates emotional memories, but does so in a neurochemical environment that's different from waking. Norepinephrine, a stress-related neurotransmitter, drops to nearly zero during REM sleep. This allows you to process emotional experiences without the physiological stress response, essentially taking the emotional charge out of memories while preserving the information. There's a phrase, time heals all wounds. Maybe it should be, sleep heals all wounds, or at least helps. Now let's consider decision-making and impulse control, the ways that sleep affects your choices, your behavior, and your judgment. The prefrontal cortex is one of the brain regions most affected by sleep deprivation. This is the part of your brain that handles executive functions, planning, reasoning, inhibiting inappropriate responses, and weighing consequences. When you're tired, the prefrontal cortex essentially goes offline first, like a brownout hitting the city's most energy-intensive neighborhoods. What happens when executive function declines? You become more impulsive, more likely to take risks, less able to consider long-term consequences. Studies have shown that sleep-deprived people are more likely to make risky financial decisions, more likely to engage in unethical behavior, and more likely to give up on difficult tasks. In one study, military personnel who were sleep-deprived for just one night showed decision-making impairments equivalent to being legally drunk. Their reaction times slowed. Their ability to assess threats decreased. Their judgment faltered. Sleep deprivation doesn't just make you tired, it makes you cognitively impaired. This has enormous implications for safety. Drowsy driving kills more people than drunk driving in many countries, yet we treat it far less seriously. A person who's been awake for 24 hours has cognitive impairment equivalent to a blood alcohol level of 0.10%, above the legal limit for driving in most places. But while drunk driving carries severe penalties and social stigma, we often celebrate or admire people who pull all-nighters, who burn the midnight oil, and who sacrifice sleep for productivity. Medical residents, who routinely work 30-hour shifts with little to no sleep, make more medical errors. Surgeons who've slept less than 6 hours are more likely to have complications during procedures. Truck drivers who violate hours of service regulations cause more accidents. The data is clear and consistent. When people don't sleep enough, their judgment suffers and people get hurt. But it's not just about dramatic failures and accidents, it's about the small decisions too. Choosing what to eat, how to respond to a colleague's comment, whether to exercise or skip it, whether to be patient with your child or snap at them. All of these decisions are influenced by how well you slept last night. Let's talk about creativity for a moment, about innovation and insight, and those sudden moments of clarity that feel like gifts. There's something called the default mode network in your brain. It's a set of brain regions that become active when you're not focused on the external world, when you're daydreaming or letting your mind wander. This network is crucial for self-reflection, for imagining the future, and for making connections between seemingly unrelated ideas. During REM sleep, the default mode network is highly active. At the same time, the parts of your brain that filter out irrelevant information and that keep you focused and on task during waking hours are dialed down. The result is a brain state where associations flow more freely, where ideas that would normally be kept separate can mingle and combine in novel ways. This is why dreams are so strange and why they sometimes contain solutions to problems you've been wrestling with. Your brain is exploring possibility space without the usual constraints. It's making connections that your conscious mind, with all its logical rules and learned patterns, might never make. Thomas Edison knew this. He would sit in a chair holding ball bearings in his hand, hovering just above a metal plate. As he drifted off to sleep, his hand would relax, the ball bearings would drop and clang against the plate, and he would wake up. He was trying to catch that liminal state between waking and sleeping, that moment when the mind becomes more fluid and creative. Salvador Dali did something similar with a key and a plate. These artists and inventors understood intuitively what neuroscience is now confirming. The sleeping brain is not turned off. It's doing different work, work that matters. Sleep doesn't just help you execute ideas better, it helps you have better ideas in the first place. Now we need to address something that many people experience but don't always talk about: the relationship between sleep and pain. Chronic pain and poor sleep form another one of those vicious cycles. Pain makes it hard to sleep, but lack of sleep also amplifies pain. It lowers your pain threshold, making you more sensitive to stimuli that would normally be tolerable. Researchers have demonstrated this in the lab. Take people who are sleeping normally, restrict their sleep to just 4 hours a night, and test their pain sensitivity. Within a few days, they become significantly more sensitive to pain. The same stimulus that would have been mildly uncomfortable becomes genuinely painful. The mechanisms are complex. Sleep deprivation affects how the nervous system processes pain signals. It increases inflammation throughout the body. It disrupts the production of natural pain-relieving compounds. People with chronic pain conditions, fibromyalgia, arthritis, migraines, and back pain often have sleep disturbances, and improving sleep can reduce pain even without any other interventions. This matters enormously for quality of life. If you're in pain, you deserve to pursue every possible avenue for relief. And one of those avenues, often overlooked, is sleep. Not as a cure-all, but as a meaningful piece of the puzzle. Let's consider aging, because sleep changes as we get older, and those changes have consequences. Older adults often complain that they can't sleep like they used to. They wake up more frequently during the night, they have trouble falling asleep, they don't spend as much time in deep sleep. These aren't just annoying inconveniences, they're linked to cognitive decline. Deep sleep is when the brain does much of that crucial cleaning we talked about earlier. As people age, they spend less time in deep sleep, which means less opportunity for the glymphatic system to clear out metabolic waste. This might be part of why neurodegenerative diseases are more common in older adults. The brain has been accumulating waste for years, with progressively less efficient cleaning each night. But here's something important. Age-related sleep changes aren't inevitable and universal. They're influenced by lifestyle, by health conditions, and by sleep disorders that often go undiagnosed in older adults. Many older people who think they just don't need as much sleep anymore actually have sleep apnea or restless leg syndrome or another treatable condition that's disrupting their sleep. The belief that older adults need less sleep is a myth. They need just as much as they did when they were younger. What changes is their ability to get it, not their need for it. And when older adults do get adequate, high-quality sleep, they show better cognitive function, better mood, and better physical health. Sleep still matters, perhaps more than ever. Now let's explore something that affects many people in modern life: artificial light and screens. For most of human history, the sun dictated when we woke and when we slept. We spent our evenings in darkness or by dim firelight. Then came electric lighting, then television, then computers and smartphones, tablets and e-readers. All of these devices emit blue light, which is the wavelength of light that most strongly affects our circadian rhythms, our internal biological clocks. Blue light signals to your brain that it's daytime and that you should be awake and alert. It suppresses the production of melatonin, the hormone that helps you feel sleepy and prepares your body for sleep. When you stare at a bright screen in the evening, you're essentially telling your brain it's the middle of the day. Your body delays the production of melatonin. You don't feel sleepy at your normal bedtime. You stay awake later. And if you have to wake up at a fixed time for work or other obligations, you end up sleep deprived. This is called social jet lag, and it's incredibly common. People stay up late on screens, then use alarm clocks to wake up earlier than their bodies naturally would. They're living in a constant state of circadian misalignment, where their internal clock says one thing and their schedule demands another. The solution isn't to abandon technology, it's to be thoughtful about when and how you use it. Dim your screens in the evening. Use blue light filters. Establish boundaries around screen time before bed. Create a buffer zone between the bright digital world and sleep. Your brain needs that transition. It needs a gradual dimming, a winding down, a signal that the day is ending and rest is coming. Without it, you're fighting your own biology. We should talk about sleep debt. This is the accumulated deficit that builds up when you consistently don't get enough sleep. Many people think of sleep like a bank account. Miss a few hours during the week, catch up on the weekend, and you're square. But it doesn't quite work that way. You can recover from short-term sleep deprivation by sleeping more for a few nights. But chronic sleep debt, months or years of insufficient sleep, doesn't disappear with one good weekend. The effects accumulate in ways that aren't always obvious. You adapt to functioning on less sleep. You might not feel as tired as you did at first, but objective measures tell a different story. Your reaction times remain slow. Your cognitive performance stays impaired. You've simply adjusted to a diminished baseline. You've forgotten what it feels like to be fully rested. This is particularly insidious because you don't realize how impaired you are. Studies have shown that people who are chronically sleep deprived lose the ability to accurately assess their own cognitive function. They think they're doing fine. They're not. The good news is that prioritizing sleep can start to reverse these effects. Not overnight, but gradually. Your body begins to recover. Your brain starts to function better. You might be amazed at how much better you feel after consistently getting adequate sleep for a few weeks. It's like upgrading to a version of yourself you'd forgotten existed. Let's consider individual differences, because not everyone sleeps the same way. There are genuinely different chronotypes, morning larks who wake up naturally at dawn, and night owls who come alive in the evening. These aren't just preferences or habits. They're biological differences in circadian rhythms, influenced by genetics. Trying to force a night owl to function at their best at 7 in the morning is like asking them to work while jet-lagged. Their body clock says it's the middle of the night. Modern society is built for morning people, early school start times, 9 to 5 work days, morning meetings. This creates real hardship for people whose biology runs on a different schedule. They're constantly fighting their natural rhythms, perpetually sleep deprived because they can't fall asleep early enough to get sufficient rest before their alarm goes off. There's growing recognition that this is a problem worth addressing. Some schools have shifted to later start times for teenagers, whose circadian rhythms naturally shift later during adolescence. Companies are experimenting with flexible schedules that allow people to work during their peak hours of alertness. There are also genetic variations in how much sleep people need. Most adults need 7 to 9 hours. But there's a small percentage of people who genuinely function well on 6 hours or less. They have genetic mutations that make their sleep more efficient. Unfortunately, most people who think they're in this category aren't. They're just chronically sleep deprived and used to it. The key is self-awareness. Pay attention to how you actually feel and function, not how you think you should feel. Your body knows what it needs. Now, as we move toward the end of our journey together, let's talk about what good sleep actually looks like and how to get it. Sleep isn't just about duration, quality matters too. You could spend 9 hours in bed, but wake up feeling exhausted if that sleep is fragmented or doesn't include enough time in deep sleep and REM sleep. Your sleep cycles through different stages throughout the night. Light sleep, deep sleep, REM, sleep, back to light sleep. Each cycle takes about 90 minutes, and you typically go through 4 to 6 cycles per night. Each stage has different functions. Deep sleep is when that glymphatic cleaning happens, when growth hormone is released, and when your body does much of its physical repair. REM sleep is when most dreaming occurs, when emotional processing happens, and when creative connections are made. You need both. And you need them in the right proportions, which generally means you need enough total sleep time for multiple complete cycles. Creating conditions for good sleep starts with consistency. Your body thrives on routine. Going to bed at roughly the same time each night and waking up at roughly the same time each morning helps regulate your circadian rhythm. Yes, even on weekends. Sleeping at drastically different hours on Saturday and Sunday can make Monday morning feel like jet lag. Your sleep environment matters. Cool temperatures help. Your body temperature needs to drop slightly to initiate sleep, so a bedroom that's around 65 to 68 degrees Fahrenheit is ideal for most people. Darkness helps. Even small amounts of light can interfere with melatonin production, so blackout curtains or an eye mask can make a difference. Quiet helps, or, if you live in a noisy environment, white noise or earplugs. What you do before bed matters too. That wind-down period we talked about, dimming lights, putting away screens, engaging in calming activities, reading a paper book, taking a warm bath, gentle stretching, meditation or deep breathing. What you avoid matters. Caffeine has a half-life of about 6 hours, which means that if you drink coffee at 4 in the afternoon, half of that caffeine is still in your system at 10 at night. Alcohol might make you feel drowsy, but it disrupts sleep architecture, reducing REM sleep and causing fragmented sleep later in the night. Exercise helps with sleep, but timing matters. Vigorous exercise too close to bedtime can be stimulating. Earlier in the day is generally better. These aren't rigid rules. They're guidelines, principles that you can adapt to your own life and circumstances. The goal is to work with your biology rather than against it. Let's address something that many people struggle with: what to do when you can't sleep. Lying in bed awake, watching the clock, feeling anxiety build as the hours tick by. This creates a negative association between bed and wakefulness. Your brain starts to learn that bed is where you lie awake and worry, rather than where you sleep. If you've been lying awake for more than 20 minutes or so, get up, leave the bedroom, do something quiet and unstimulating in dim light. Read something boring, listen to calm music. Wait until you feel genuinely sleepy, then return to bed. This helps retrain your brain to associate bed with sleep rather than wakefulness. Paradoxically, trying hard to fall asleep often backfires. The effort itself creates tension and anxiety that prevents sleep. Sometimes the best approach is to let go of trying. Focus on simply resting, on breathing slowly, on relaxing your body. Sleep often comes when you stop chasing it. For chronic insomnia, cognitive behavioral therapy for insomnia, CBTI, is the gold standard treatment. It's more effective than sleeping pills in the long term and doesn't have side effects. It involves changing thoughts and behaviors around sleep, addressing the underlying patterns that maintain insomnia. Sleeping pills have their place, but they're not a long-term solution. Many of them don't produce natural sleep architecture. They sedate you, which is not the same as healthy sleep, and they can create dependency. If you're relying on sleeping pills for months or years, it's worth exploring other options with a healthcare provider. As we near the end of our time together tonight, I want to zoom out and think about what all of this means. Sleep is not an indulgence. It's not laziness. It's not time wasted. Sleep is when your brain cleans itself, when your memories are consolidated, when your body repairs tissue, when your immune system builds defenses, and when your emotions are processed and regulated. Sleep is when growth happens, when healing happens, and when integration happens. We live in a culture that often treats sleep as negotiable, as something to sacrifice in pursuit of productivity or success. We admire people who brag about getting by on 4 hours a night. We wear our exhaustion like a badge of honor, proof of our dedication and hustle. But this is misguided. Sleep is not the enemy of productivity. Sleep is the foundation of productivity. A well-rested brain works better in every way. Better focus, better memory, better problem solving, better decision making, better emotional regulation, better creativity. If you want to be effective at anything, you need to sleep. And beyond effectiveness, beyond productivity, there's simply the experience of being alive. The quality of your days depends on the quality of your nights. When you're well rested, the world looks brighter. Food tastes better. Conversations are more engaging. You have more patience, more energy, and more capacity for joy. Sleep isn't just about what you can accomplish. It's about how you experience being human. There are societal changes we need to make this easier. School start times that align with adolescent biology. Work cultures that don't glorify overwork and sleep deprivation. Healthcare systems that screen for and treat sleep disorders. Urban design that reduces noise pollution. But you don't have to wait for society to change. You can start prioritizing your own sleep tonight. You can recognize that those hours of darkness matter. You can protect them, value them, and treat them as non-negotiable. There's something almost sacred about sleep when you really think about it. Every night you practice a kind of trust. You lie down, close your eyes, and surrender consciousness. You let go of control. You become vulnerable. And you trust that your body knows what to do, that it will keep your heart beating and your lungs breathing, that it will carry out all those invisible processes of repair and renewal, and that you will wake up again. In a world that demands so much of us, constant connectivity, endless productivity, perpetual availability, sleep is one of the last bastions of necessary disconnection. When you're asleep, you can't check your email. You can't respond to messages. You can't work on that project or worry about that deadline. You're simply not there, not available, not online. And maybe that's part of why we resist it. Maybe sleep feels like falling behind, like missing out, like losing ground in a race that never ends. But what if we've got it backwards? What if sleep isn't falling behind? It's catching up. Not losing ground, but gaining it. Think about the metaphors we use. We fall asleep, as if it's a descent, a dropping away. But perhaps it's more accurate to think of it as a return, a coming home, a settling back into your body, into your breath, into the quiet rhythms that sustain you. Every creature that sleeps is performing a kind of biological poetry. The dolphins who rest half their brain at a time, keeping one eye open to watch for predators, while the other half dreams of whatever dolphins dream of. The birds who lock their talons around a branch so they don't fall even as they slip into unconsciousness. The otters who hold hands while they sleep so they don't drift apart in the current. We humans, with our complex brains and anxious minds, sometimes make it harder than it needs to be. We fight our tiredness with caffeine and artificial light. We schedule our lives in ways that conflict with our biology. We fill our bedrooms with screens and distractions. We bring our worries to bed with us like unwelcome companions. But underneath all of that, your body still knows. It knows the ancient rhythms of waking and sleeping, of activity and rest, of exertion and recovery. Your body knows how to sleep. You did it instinctively as a baby. You can learn to do it well again as an adult. Let's think for a moment about dreams. We haven't talked much about them, but they're an integral part of sleep, particularly REM sleep. And they're utterly mysterious. Science can tell us a lot about what happens in the brain during dreaming. We know which regions are active, which neurotransmitters are present, and which stages of sleep produce which types of dreams. But the subjective experience of dreaming, the vivid narratives, the impossible physics, the emotional intensity, remains strange and wonderful. In dreams, you can fly. You can visit places that don't exist. You can speak with people who died years ago. Time bends and breaks. Cause and effect become optional. Your waking mind knows that none of it is real, and yet in the dream, it feels completely real. You're genuinely surprised when you discover you can breathe underwater. You're genuinely afraid of the shadow figure approaching. Some people remember their dreams vividly every morning. Others rarely remember dreaming at all, though studies show that everyone dreams multiple times each night. The dreams are there. The remembering is what varies. There have been many theories about what dreams mean. Freud thought they were disguised wishes. Jung saw them as messages from the unconscious. Modern neuroscience tends to view them as a byproduct of memory consolidation. Your brain sorting through the day's experiences, making connections, sometimes creating bizarre narratives out of random neural firing. But maybe the meaning of dreams isn't what they represent. Maybe their meaning is simply that they happen, that your mind is creative enough, flexible enough, to construct these elaborate scenarios every night, that even in unconsciousness, some part of you is still weaving stories. You spend years of your life in these internal worlds that vanish the moment you wake. All those dream places you've visited, all those dream conversations you've had, all those dream problems you've solved or failed to solve. It's a secret life you live every night, a parallel existence that mostly evaporates with the dawn. And perhaps that's okay. Perhaps not everything needs to be remembered or analysed. Perhaps dreams are meant to be ephemeral, like morning mist burning off under sunlight. They do their work, processing emotions, consolidating memories, making creative connections, and then they dissolve, leaving you with nothing but a vague feeling or a fragment of an image. There's something beautiful in that impermanence, in the nightly reminder that not everything can be captured or controlled or held onto, that some experiences are meant to simply pass through you. Now let's consider sleep in the context of relationships, because how you sleep affects how you connect with others, and your relationships affect how you sleep. Sleep deprivation makes you less empathetic. When you're exhausted, you have less capacity to understand others' perspectives, less patience for their struggles, and less emotional bandwidth to support them. You're more likely to misread social cues, more likely to take offense where none was intended, and more likely to respond harshly. Partners who are sleep deprived have more conflicts and less ability to resolve those conflicts constructively. Parents who are sleep deprived are more likely to be irritable with their children. Colleagues who are tired struggle to collaborate effectively. Sleep affects every relationship you have, and the reverse is true as well. Relationship stress affects sleep. Worry about a conflict keeps you awake. Loneliness makes it harder to fall asleep and stay asleep. Social support and feeling connected to others are associated with better sleep quality. For couples sharing a bed, sleep becomes a negotiation. Different chronotypes. One person is a morning lark, the other a night owl. Different temperature preferences. Different sensitivities to light and noise. One person snores, the other tosses and turns. These aren't trivial matters. They affect both partners' sleep quality and therefore their health, mood, and cognitive function. There's no shame in sleeping separately if it means both people sleep better. Some cultures find it strange that Western couples assume they must share a bed. Maybe we should question that assumption. If separate bedrooms or even separate beds in the same room mean both people wake up rested and happy, that's a gift to the relationship, not a failure of intimacy. Sleep is personal. It's individual. Your sleep needs might be different from your partner's, and that's okay. Finding arrangements that allow both people to sleep well is an act of love. Let's talk about sleep across the lifespan, because it evolves from infancy through old age, and understanding that evolution can help us be gentler with ourselves and others. Babies sleep in short bursts, waking every few hours because their tiny stomachs can't hold enough to sustain them for longer. Their sleep cycles are shorter, about 50 minutes instead of 90. They spend more time in REM sleep proportionally, perhaps because their brains are developing so rapidly and need that neural activity. Parents of newborns are often desperately sleep deprived. If that's you, know that it's temporary. It feels eternal when you're in it, but it passes. And know that your baby isn't sleeping poorly to spite you. They're sleeping exactly as they're biologically programmed to sleep. It's hard, but it's normal. Toddlers and young children need 10 to 14 hours of sleep, including naps. They're growing rapidly, learning constantly, and all that development requires serious sleep. Yet they often resist bedtime with impressive determination. This too is normal. Their emerging independence and their fear of missing out compete with their biological need for rest. Teenagers' circadian rhythms naturally shift later. A teenager who can't fall asleep until 11 at night and struggles to wake up at 6 in the morning isn't being lazy or difficult. Their biology is doing exactly what it's programmed to do during adolescence. Starting school at 7:30 in the morning for this age group is, from a biological perspective, rather cruel. Young adults can often get away with less sleep or irregular sleep schedules. They can pull all-nighters and recover quickly. This doesn't mean it's healthy or optimal, just that youth provides some resilience. But it's also when many people establish sleep habits that will affect them for decades. Middle age is when sleep problems often emerge or worsen. Hormonal changes, increased stress, health conditions and medications all can disrupt sleep. This is also when the long-term consequences of chronic sleep deprivation start becoming more apparent. Midlife is an opportunity to reassess and prioritize sleep before those consequences accumulate further. And in older age, as we discussed earlier, sleep architecture changes. But older adults who maintain good sleep hygiene, who stay physically active, and who address sleep disorders can continue to sleep well. The notion that poor sleep is just an inevitable part of aging isn't quite accurate. At every stage, sleep looks different and serves different functions. Being patient with yourself and others and understanding that sleep needs change can reduce frustration and promote better rest. We should acknowledge the privilege inherent in much of this discussion. Talking about optimizing sleep, about creating perfect sleep environments, about reducing stress, these assume a level of control that not everyone has. If you're working 2 jobs to make ends meet, you might not have the luxury of 8 hours in bed. If you're a single parent caring for young children, your sleep will be interrupted whether you like it or not. If you live in a noisy neighborhood or a too hot apartment or a homeless shelter, you can't simply adjust the thermostat or install blackout curtains. Structural inequalities affect sleep. Shift workers have circadian disruption built into their schedules. People living in poverty experience chronic stress that disrupts sleep. Communities of color face disproportionate exposure to noise pollution and environmental stressors. Access to healthcare for sleep disorders isn't equally distributed. So if you're someone who can't sleep well because of circumstances beyond your control, please know that's not a personal failing. You're not doing something wrong. Your body is responding to a difficult situation with limited resources. And for those who do have more control over their sleep, there's perhaps a responsibility to use that privilege. To sleep well, to rest well, so that you have the energy and capacity to contribute to creating a world where everyone can sleep safely and sufficiently. To advocate for policies that protect sleep, labour laws, noise regulations, housing standards, and healthcare access. Sleep is both deeply personal and inherently political. Your individual sleep matters, and the systems that shape whether people can sleep matter too. Let's return to something fundamental, what sleep actually feels like from the inside. Because for all the science we've discussed, the neurons and hormones and brain waves, sleep is ultimately an experience. There's that moment when you're hovering on the edge. You're aware that you're becoming less aware. Thoughts start to drift and blur. The boundary between waking and sleeping becomes porous. You might have a sudden jerk, a feeling of falling, and you're back on the waking side for a moment. Then you drift again. Eventually you cross over, and then nothing. Or not exactly nothing. There's some awareness during dreams, though it's different from waking awareness. But for stretches of the night, particularly during deep sleep, you're simply gone. Not there, not anywhere. And then hours later, you return. Gradually or suddenly, consciousness reconstitutes itself. You become aware of your body again, of the room, of time having passed. You open your eyes to a world that continued without you, and you rejoin it. It's extraordinary when you think about it. This daily disappearance and return, this regular rehearsal of letting go. Some spiritual traditions see sleep as a small death and waking as a small rebirth. Not meant morbidly, but as an observation of the pattern, the surrendering of consciousness, the trust that you'll return. What does it feel like to sleep well? It feels like nothing, in the best possible way. You're not aware of the hours passing. You're not conscious of being unconscious. And then you wake up feeling restored, refreshed, ready. Your body feels lighter. Your mind feels clearer. The world seems more manageable. What does it feel like to sleep poorly? It feels like time stretching and distorting, like being trapped in a strange liminal space that's neither true sleep nor true wakefulness. Hours drag by while you're aware of every sound, every uncomfortable position, and every anxious thought. And in the morning, you feel like you've been working all night, exhausted before the day even begins. The contrast between these two experiences is profound, and it affects everything that follows. As we come to the end of our exploration, let's consider one more angle, the way modern life has changed our relationship with sleep, and whether we can find our way back to something healthier. For most of human history, we slept when it was dark and woke when it was light. There were variations, of course, fires that extended the day, cultural practices around sleep, and seasonal changes in day length. But fundamentally, our sleep was tied to natural light-dark cycles. Then we invented ways to control light: candles, oil lamps, gas lights, and electric lights. Each innovation pushed back the darkness a little further. We could be productive for more hours. We could socialize late into the night. We could read or work or play whenever we chose. This is progress in many ways. Light brings safety, opportunity, and connection. But it also severed the natural link between darkness and sleep. We're now in a constant state of artificial day. We decide when to sleep not based on light availability, but based on schedules, obligations, and entertainment options. And we've become collectively sleep deprived. Studies show that on average, people sleep about 2 hours less per night than people did a century ago. That's a massive shift in a relatively short time, evolutionarily speaking. We're running an uncontrolled experiment on ourselves. What happens to a species that suddenly reduces its sleep by 25%? We're finding out. rising rates of obesity, diabetes, heart disease, depression, anxiety, and dementia. Sleep deprivation likely contributes to all of these. So what do? We can't uninvent electric light, nor would we want to. But we can be more intentional. We can recognize that just because we can stay up all night doesn't mean we should. We can create boundaries that our grandparents didn't need because darkness provided natural boundaries for them. We can treat sleep as a form of preventive medicine, as an investment in our health, our relationships, and our quality of life. We can push back against cultural messages that equate sleep with weakness or laziness. We can model healthy sleep habits for our children. We can design our lives as much as possible to support rather than undermine our biology. This isn't about returning to some idealized past. It's about moving forward with wisdom, taking what's best about modern life, the safety, the opportunities, the connections, while also honoring the ancient needs of our bodies. So here we are, near the end of this journey through the landscape of sleep. We've explored your brain, your body, your emotions, and your memories. We've looked at what happens when sleep goes well and what happens when it doesn't. We've considered the science and the poetry, the personal and the political. If you take nothing else away from this, take this. Sleep matters. It matters more than you probably realized. It's not optional. It's not negotiable. It's foundational to everything else you want to do or be. You deserve to sleep well. Not as an indulgence or a luxury, but as a basic requirement for health and well-being. Protecting your sleep is an act of self-respect. It's saying, my health matters. My mind matters. My capacity to be present and engaged with life matters. And when you sleep well, you show up differently in the world. More patient, more creative, more resilient, more capable of joy, better able to handle challenges, more fully yourself. The world needs well-rested people. People who can think clearly, feel deeply, create boldly, and connect authentically. People who have the energy and emotional bandwidth to care for others and work toward positive change. Your sleep is a gift, not just to yourself, but to everyone whose life touches yours. So tonight, when you finish listening to this, when you turn off the light and settle into your bed, do so with intention. With gratitude for your body's ability to heal and renew itself. With trust in the process that has sustained life for millions of years. Let go of the day. Let go of your worries, your to-do lists, your regrets, and your anxieties. They'll still be there tomorrow if you need them. Right now you have one job: rest. Feel the weight of your body sinking into the mattress. Notice your breath, that steady tide that's been with you since your first moment and will be with you until your last. Feel it slow and natural as you relax. Your brain is ready to do its work, to clean and repair and consolidate and create. Your body is ready to heal. Your immune system is ready to build defenses. Your heart is ready to slow and rest. All the invisible machinery of your being is poised to carry out the miraculous maintenance that happens every night. You don't have to do anything. You don't have to try. You just have to allow it, to surrender, to trust. And in the morning, you'll wake to a world that looks a little brighter, feels a little more manageable, and holds a little more possibility. Because you gave your body what it needed. You honored the necessity of rest. You acknowledged the wisdom of sleep. This is why sleep is really important. Not just for survival, but for flourishing. Not just for functioning, but for thriving. Not just for getting through life, but for truly living it. So sleep well. Sleep deeply. Sleep enough. Your body is waiting to restore you. Your mind is waiting to refresh itself. Your life is waiting for you to show up fully rested, fully present, and fully yourself. The darkness is not empty. It's full of healing. full of renewal, full of preparation for tomorrow. Let yourself fall into it. Let yourself rest. Let yourself sleep. Good night.